Overall, this Lyme disease research may be a make-work project, but as someone who personally knows people affected by this infection and some of its sneaky co-infections, it's great that they're undertaking this research. But when the lay abstract written by Dr. Moore says things like this on page 76, that our network will mobilize and build LD, that's Lyme disease, specific capacity training opportunities, improve clinical science and practice, provide best evidence in testing and patient care, improve patient outcomes, and inform policy, I look at the history and epic failures of the COVID response, all of those key players that circle back to include awful advisors, knee-jerk reactions coupled with hysterical groupthink, and well, naturally, I have some doubts. Remember when everyone aged 12 and up was coerced into receiving a biological drug over threats of being terminated and or ostracized from society unless they regularly and willingly displayed a government-downloaded QR code highlighting their medical status? In Ontario, one of the key advisors of this policy was Chief Medical Officer of Health, Dr. Kieran Moore. In a report that I did a few months ago, during a time when he was using pretty extreme segregationist language that was sowing division between vaccinated and unvaccinated Ontarians, I found that Moore has a questionable connection to the manufacturer of the very products that he was indiscriminately endorsing.
This is a very serious problem. We have a very serious problem here.
You can call my doctor.
His conflict of interest is with one of the main COVID injectable manufacturers, none other than the largest healthcare fraudster, Pfizer. And I wanted to know how this connection affected, or rather influenced, Dr. Moore's ability to provide unbiased, balanced directives to Ontarians and the Ontario government, including Premier Doug Ford, on vaccine mandates. This all went back to a presentation in March 2021 that hosted Dr. Kieran Moore back when he was just a regular local medical officer of health. As a panelist for the presentation titled Changing the Way We Work, at the onset of the presentation, he declares the following conflicts of interest.
Oh, hi, my name's Kieran. I'm a medical officer of health in Kingston, Frontenac, Lennox, and Addington, and I am grounded in primary care, emergency medicine. I've practiced clinically for the vast majority of my career, and I'm honored to be invited to speak with you today. I do receive grants from the CIHR for Canadian Lyme Disease Research Network, for which I'm the principal investigator. Have an honoraria from the Ontario College, and I'm on the advisory board of Pfizer for their Lyme disease North American strategy.
So Dr. Moore is on the Pfizer Lyme disease advisory board for their North American strategy. I mean, he says it there himself. A few months later, when Dr. Moore became Ontario's Chief Medical Officer of Health in early July of 2021, it wasn't long thereafter, in August, that he issued Directive Number 6, which mandated all public hospitals to put a vaccine policy in place. Although exemptions and refusal to disclose your personal private medical history was supposed to be built into these same policies, hospitals were largely left to their own devices to interpret and implement this directive as they saw fit. And so many opted for forceful vaccine compliance with little to no wiggle room. By the end of September, this mandatory vaccine requirement further spread to almost all indoor public settings and facilities. Vaccine compliance spread all right as people became increasingly coerced into compliance to remain gainfully employed, continue their education, their extracurriculars, and simply partake in, the fun aspects of society that had been stolen from the general public for the last year and a half. But it certainly did not stop the spread of a seasonal respiratory virus. Now still, I'm left wondering, how ethical is it that the same doctor who sits on an advisory board for Pfizer was also forcing compliance with their products by way of a government directive and requirement? I wanted to know what Dr. Moore's title was on the Pfizer advisory board and what might be involved financially. And because Dr. Moore didn't respond to my email seeking clarification, Despite the fact that my tax dollars go to fund his $400,000 and change yearly salary, I had to file an ATIP, an access to information request, to find out. And this could get costly because I'm going to show you what I received back. And before I do that, I want to thank all of our generous donors for their financial assistance at rebelinvestigates.com. Your donations there help to ensure that I can pursue this type of investigative journalism and appeal it when it's needed. So first and foremost, there's nothing in here about Pfizer or its Lyme disease vaccine developing subsidiary, Valneva. Whether it's redacted or not in here, there's nothing. I don't know. It's why we're appealing the decision, the response, and requesting certain things be unredacted, like the stakeholders and what branch committee is redacted under, for instance, D on page 104. We're also filing more ATIPs to obtain the annual reports that the National Research Network on Lyme disease is supposed to put out, and we're requesting the structured end of grant report that is discussed on page 169. The ATIP confirmed some of what I already knew. There is a funding agreement between the Canadian Institute of Health Research and the National Research Network for Lyme disease. It's done in partnership with the Public Health Agency of Canada for a grand total of just shy of $4 million over 5 fiscal years. Dr. Moore is the principal investigator, and the funds were set to begin in September 2018 and end in August of 2022, so that's coming up soon. His host institution, also one of his employers, Queen's University in Kingston, Ontario, is the receiver of this grant. On page 19 of the ATIP, you can see that other recipients of the grant include COVID hysterics like Dr. Tamara Ugolini, who co-founded COVID-19 Resources Canada earlier this year. Earlier this year, Premier of Saskatchewan Scott Moe challenged her assertions that Saskatchewan's death toll was likely a whopping 7 times higher than the official reporting data showed. He called her claims nothing more than misinformation that should be challenged. And while I don't recall ever having interacted with Dr. Ugolini, in fact, I didn't even know who she was until I received this ATIP back, it turns out that she has blocked me on Twitter. Surely there are some fanatical tweets to be found in there somewhere. Further on, you can find another fund recipient is Dr. Todd Hatchett, who is Chief of Microbiology for the Nova Scotia Health Authority, and he advocates to go against manufacturer instruction and swab your nose and throat, with those super reliable rapid antigen tests to increase your likelihood of getting a positive result. That's convenient. His declared conflicts of interest with the Canadian Lyme Disease Research Network include funded grants or clinical trials with Pfizer, where he examined influenza vaccine effectiveness. You literally can't make this stuff up. Dr. Samir Patel is yet another fund recipient, and he has a direct declared interest in that he is employed directly by Public Health Ontario. It looks like Dr. Moore didn't declare any sort of Pfizer conflict of interest or connection in his declaration for the Lyme Research Network. Otherwise, the ATIP does not provide any information on Moore and this alleged Pfizer connection. When I reached out to Valneva Canada, that's again the Pfizer subsidiary who has the VLA-15, which is the only Lyme disease vaccine candidate currently in clinical development, they told me that there is no Lyme disease vaccine clinical development or trial taking place in Canada. I also reached out to the Canadian Centre for Vaccinology to ask them what role they play in the Lyme Disease Research Network and if they're looking at any sort of vaccine development. Overall, this Lyme disease research may be a make-work project, but as someone who personally knows people affected by this infection and some of its sneaky co-infections, it's great that they're undertaking this research. But when the lay abstract written by Dr. Moore says things like this on page 76, that our network will mobilize and build LD, that's Lyme disease, specific capacity training opportunities, improve clinical science and practice, provide best evidence in testing and patient care, improve patient outcomes, and inform policy, I look at the history and epic failures of the COVID response All of those key players that circle back to include awful advisors, knee-jerk reactions coupled with hysterical groupthink, and well, naturally, I have some doubts. For Rebel News, I'm Tamara Ugolini. Vaccine passports were unscientific and unethical, and we called it from the beginning. It's why we have set up a special page to crowdfund litigation for plaintiffs in the unfortunate receiving end, who have been on the unfortunate receiving end of such heavy-handed policies. You can stay up to date with active litigation that wouldn't be possible without the generosity of our donors at fightvaccinepassports.com. At that website, you can donate if you're able to and sign our petition to end vaccine passports and mandates once and for all. That website again is fightvaccinepassports.com.